There we go. Fantastic.
So we're recording, we're underway.
Yes, we are indeed.
Well, thank you everyone for joining us today. My name's Ross Iles. This is the second driving health webinar that we'll be presenting. This one is focused on mental health and will be presented by my colleague, Dr. Elizabeth Pritchard. I'll introduce Elizabeth in a moment. But just a very quick background about what we're doing here with our webinars. The Driving Health Project has been running for 2.5 years now. We have quite a lot of information that we've found throughout the project. And what we're aiming to do is to present bite-sized snippets of the information that we've uncovered along the way, some things about the problem that we found, but then we're not just going to sit around and admire the problem. We're actually going to look at, well, what are some potential solutions? And that's what the Driving Health Project is all about, getting a good idea and grasp of the challenge for drivers to be healthy and stay healthy at work. And then really to be looking at some of the solutions that might be available. So today's webinar will be presented by Dr. Elizabeth Pritchard. Elizabeth is a research officer in the Insurance Work and Health Group at Monash University. Elizabeth has led multiple components of the driving health study, including the in-depth interviews with truck drivers and their family members, and then also the development of our training program intervention, which we'll hear a bit more about later. So with no further ado, I'll hand over to Elizabeth. Thanks, Elizabeth.
Thanks, Ross. That's brilliant. And welcome, everybody. Fantastic to have you here for our second webinar, as Ross mentioned. If you have questions, there's a couple of places you can do questions. You can put it in the chat box, or there's a Q&A place as well. So we will be having question time at the end. So please make sure that we don't lose your questions. Pop them in as you go, but we'll address them at the end. So I'll just give you a little bit more of a background or an outline about the Driving Health Project and the Driving Health Study. So it's a 3-year research partnership with Linfox, the New South Wales Centre for Work Health and Safety, and the Transport Workers Union. And it's also been supported by the National Health and Medical Research Council Partnership Project Scheme, as well as us from Monash University. So to our knowledge, it is the largest Australian-based study which focuses on the health and well-being of truck drivers in Australia. While there's a large body of research coming from North America and Europe, we believe it's really critical to have local evidence that represents Australian drivers working in Australian conditions. So the Driving Health Study has examined multiple sources of data, as you can see here on the screen. For example, more than 120,000 accepted claims for workers' compensation we have analysed. We've looked at some of the data resources for the first time. For example, 3,500 death benefit claims from the largest industry superannuation fund for workers in transport as well. And we've also generated new data from over 1,400 drivers in the form of an online survey. And some of you who are listening to this may have answered this online last year before last, I think it was, then we analysed it last year. Also some follow-up surveys and also some in-depth interviews with drivers and also family members. So the result is that we have a really clear picture to date of what the health and well-being is of Australian truck drivers. Now, one of the areas of concern in the industry is mental health, and that's what we're focusing on today. We have a whole range of areas that we're looking at and that have emerged from our findings. However, today we're looking at mental health. And we asked drivers specifically in the online survey to get a little bit more detail as well in the telephone survey about their level of psychological distress. So that's where we're focusing initially today as well. So psychological distress is described as a state of emotional suffering, which is associated with those stresses and demands that we have each day and we find difficult to cope with in daily life. So if we leave this unrecognised and we don't address psychological distress in the early stages, this can lead to high levels of stress and mental ill health. So therefore, if psychological distress is present, we need to address this in the early stages or within any intervention so that we have an emphasis on prevention and also putting in place intervention and ways of supporting drivers. So there's different levels of psychological distress as identified in the tool that we used in the data that we gathered. And this is recorded from low to moderate to severe. So when we talk about severe psychological distress, this is at a level of concern that requires intervention from an appropriately trained health professional, for example, a psychologist or psychiatrist. So that is, if people have severe psychological distress, they need to be seeing a health professional specifically for that distress. And we'll talk a little bit more about who accesses help and further on throughout my presentation. So there are many things that impact the quality of life and mental health of a driver each day. And if any of you are drivers on here, you will know exactly what they are. So from the data that we collected, it can range from the quality of the roads, the state of the truck, family life situation, amount of sleep that you get, the health routines that you have, the way drivers are treated by the public, by the company, and also by regulators, policymakers, and the like. All of these factors impact to some degree on the mental health of the driver and whether they experience any psychological distress, level of anxiety or depression, or more serious mental health issues. So because of the importance of maintaining and improving mental health for all of the workers in any workspace, but particularly for drivers with the added pressures of isolation on the road and the other factors that I've mentioned already, psychological distress was one of the specific areas we measured in the online and telephone surveys, and these are the results that we found. Just over 50%, or 1 in 2 drivers surveyed, experienced some form of psychological distress, with over a third, 37%, demonstrating moderate distress and over 13% with severe distress across all of the age groups. This is concerning from the information I've just said. 1 in 4 drivers, around 20%, reported being diagnosed with a mental health condition already, and this is quite comparable with the national health statistics for Australian men. Younger drivers under the age of 35 experienced significant levels of psychological distress, with 22% in the severe distress range, which is almost double that of the Australian male of the same age, which is 12%. So this is 4 times greater odds of having psychological distress than that of older drivers, and older we mean 55 years and older. Other components that we found from the research that are linked with psychological distress or increased psychological distress were long work hours, between 41 and 60 hours on the road, was associated with increased psychological distress as well. It was also found that drivers working less than 40 hours a week had half the odds of experiencing severe psychological distress. So it's good to work less than 40 hours a week if we're looking at this. And those working over 60 hours a week as well had less psychological distress. Now that may be one of those statistical anomalies where there was just a very small number of people who worked over 60 hours. There were other factors as well, physical health conditions. Those with 3 or more health conditions, such as back problems or arthritis or a traumatic injury or migraines, all had significantly higher odds of experiencing severe psychological distress. Short haul drivers had significantly higher odds of severe psychological distress than long haul drivers. And this may be attributable to the increased stress of the motorists in the traffic. Analysis of the life insurance claims of individuals within the industry, the transport industry, showed that suicide is the second leading cause of death in transport workers under the age of 39 years, and the second leading cause of non-work related deaths, based on the data that looked at the whole of transport industry, not just drivers. Workers' compensation data showed that truck drivers are much less likely to access mental health services than other workers, and only do so after some time has lapsed. And this is in comparison with accessing help for things like they need a general GP or a physio for. So they're less likely to get help for mental health conditions than physical health conditions. So this later fact is particularly concerning as we need to think about the stigmatization in the industry of people talking about mental health or asking for help in an industry that is male dominated and has a certain response to admitting that the need of help is not a good idea within the industry. And we've got more data that backs that up as well. So information from the telephone survey, and this was 332 people that were interviewed in a little bit more depth on the telephone. They explored more about the factors impacting psychological distress as well, and found that while just over 50% experienced no psychological distress, 37% experienced moderate distress and 12 severe distress. Again, this is similar to the original factors overarching those 1,400 people in the online survey. So this is still concerning because, as we mentioned, if left without seeking help from a trained professional, these drivers could progress into higher levels of ill health. And this in turn would impact their safety on the road, relationships, physical health, and the ability for the industry to sustain a healthy workforce overall. Now, the telephone survey results also identified 6 domains that strongly impacted the level of psychological distress that drivers felt. And these were personal domain, which included things like their age, family situation, pre-existing mental health conditions, financial stress; occupational domain, payment type, how they were paid, whether it was per kilometre or per job; their work shifts, driving experience; their workplace or occupational and environmental factors; regulatory domains, how much training they got; their lifestyle domains around diet; health risk domains, fatigue, loneliness, body mass index. And as we know, health is multifaceted. So there is not one cause of a problem or one solution. And in completing the in-depth interviews, we got an even deeper understanding of the interaction between these factors and some possible solutions as identified by the drivers and the family members. I'm going to go on to talk a little bit about that. So the drivers and family members talked about the lack of understanding people had around mental health in all areas of the industry. This included drivers themselves experiencing anxiety or depression and not being aware of this as mental health or mental ill health. And also how many drivers did not feel that they could talk to anyone around how they were feeling about it. Many stated that they were afraid that they might lose their jobs if they admitted that they were feeling stressed or anxious or concerned about certain things in their life. Drivers talked about the, and this is quote, male macho mentality many drivers had, and family members discussed how their partners didn't want to admit a problem for fear of seeming weak, losing their job, or just not being aware of what was happening. And one person said, for example, a short fuse may be indication that they were experiencing mental health challenges, but they didn't know it. There's a couple of quotes that are coming through as well that you can see on screen. Both groups identified the extensive factors that were beyond the driver's control during a day and how this increased stress and negatively impact their ability to do their job and maintain a healthy body and mindset. Many talked about the unrealistic demands of the schedules and the way that they were spoken to by their bosses. Some were being bullied and some were being yelled at. Others mentioned working with incredible bosses and companies and how their boss was always interested in them as a person, their family, and even concerned about finances if they needed to take some time off. The environment of the roads, the weather, the roadworks, the lack of on-road facilities, the lack of parking facilities, the lack of access to healthy foods at truck stops, interrupted sleep patterns, lack of say over shifts and schedules, all contributed to increased stress and poor mental health for many drivers. And they also talked about the work culture in the trucking industry, which was described as keep quiet, don't admit anything, as you may lose your job. That was a quote. Family members talked about how many drivers didn't really understand necessarily what was happening either. And the strain of isolation on the road and separation from family members for many days on end for long-haul drivers seemed to take its toll over time on levels of distress and also mental health. Some drivers talked about the difficulty they had with the transition of coming back home, where their spouse or partner was basically single parenting all week and now had to accommodate dual parenting. This transition was discussed by one person who said that he felt unwelcome when he got home after being on the road for a week. These interviews reinforced the extent of what was coming through in the online and telephone surveys, that the factors driving mental health were complex and multifactorial. There is no one quick fix because there are so many facets to address. The driver, the company, the processes, the regulations, the policies, the public, just to name some of them. Drivers and family members found it difficult to suggest actual solutions that they saw could possibly work. However, there were some themes that came through, and I'll go through some of those now. There was an emphasis on the importance of strong connections with people. For some, this was family and the family unit back home. Others, it was a great relationship with their boss. Some had mates on the road and at the same time, who were driving at the same time as them, and they connected through radio conversations on the long, lonely trips on the road, particularly during the night. Those that made time to connect with others once home again displayed stronger levels of coping and appeared to have higher levels of optimism when talking about their lives and the future. Many talked about the workplace culture and how important it was for managers to treat each driver as important and respect them as a person. They also discussed how there needed to be more of a greater emphasis on mental and physical health. For example, don't reward drivers at the depot with donuts, but something healthier to set a good example. And another person talked about how they needed to have blood pressure and diabetes checks, as well as the alcohol and drug checks. Now, some companies were identified as having these things in place already, and they were applauded by the drivers that I interviewed for changing the workplace culture. They also identified how we all need to decrease the stigmatization of mental health discussions in the industry. Several of the drivers I interviewed talked about receiving help from a professional, one from a company chaplain and two from either a psychologist or psychiatrist. Each of these men described how useful this was in helping them with coping strategies. One was after a traumatic event and the other was after a culmination of strategies of little pressures building up, and how they were much less stressed and much happier now. One couple shared how they had gone to marriage counselling and it had saved them from separation and divorce. Seeking help from health professionals needs to be promoted as the norm and good to go to, rather than a stigmatisation of weakness, illness, or threat of being fired. Revisiting regulations, also particularly around fatigue regulations, was also discussed. Several drivers talked about how they had to drive when tired and sleep when not sleepy because of the rigidity of the logbooks. Waiting times impacted levels of fatigue, and it was very difficult often to meet delivery deadlines when there was a whole lot of waiting time when you were technically resting, however they weren't. They all talked about the need for an industry-wide approach to impact mental health concerns, that the drivers are doing their best to be healthy in many ways. Many of the drivers had regular checkups, were finding places to get help, were eating as healthily as they could on the road, were doing some exercise at some time of the day, and still their health status was not good. They talked about how managers needed to support their health factors, as mentioned above, and also to give the drivers a say in their scheduling. So the upshot of the findings in the area of psychological distress is that the industry has concerning numbers of drivers experiencing psychological distress and needs to have a multi-pronged approach to address this within the industry so that the drivers can be healthy and stay healthy at work. While there are many interventions currently targeted and towards the actual driver to improve health, we also need to consider the wider breadth of players in the industry and consider programs and interventions across the other areas as mentioned. So to address some of these factors, we are targeting as the next stage of this study, an intervention program towards line managers, allocators, and supervisors within driver companies to complement the programs that are already out there and currently in place. So to help support the industry following the findings from our research, we have created a free short 20-minute online training program, which is going to be launched in October for allocators, line managers, and supervisors to identify the areas that they can have influence over in relation to helping the drivers maintain and improve their mental health and physical health. Many people think, well, it's just up to the driver to be healthy and stay healthy. But we know from over the 2 years of research that the solutions are complex and require a multi-pronged approach for solving this issue. It is not just about the driver, it is also about the industry, the regulations, and the way each company works with and supports the drivers as well. So we would love to offer you this free training. Now we're going to put in the chat box the link for, yes, the link's in there, awesome, already in there, thank you, Ross. There's the link in there for you to register your interest so that you can be one of the first people who can do this training. 15 to 20 minutes for your allocators, line managers, and supervisors to do this training package. So please click on the link and sign up to register your interest for the October launch and when the program becomes live. And share this with amongst your friends, colleagues, and workmates as well. It is vital that we all work together to improve the health and well-being of drivers and the industry overall. So if you require any further information, I'm going to give you some contact details. We would love you to sign up to be part of the implementation program. As I said, it was only 20 minutes that we're looking of your time. It's going to look at those factors that you can influence from that level of allocator, supervisors, and line managers, and give you a whole resource as well. So if you wanted to contact us, remember our website is drivinghealth.net and our email contact is info@drivinghealth.net. So that brings us to the end of the actual formal part of the presentation, and we're happy to ask questions, answer questions.
Thanks very much, Elizabeth. I've got a question here from Sally. She's asked, could you please let me know what your measure of psychological distress was?
Sure, it was the Kessler-6, Sally. So we measured it on the Kessler-6, which is a validated scale, and it has 6 questions. I won't go into the detail. If you want to know the specific details, it's in the report, in report 6 and report 8 on our website. If you want to know the specifics about that, and also the link, the citation and things around that. And so it was looking at the factors that impacted how they responded in a day.
Okay, we've got some more questions coming in. I'll just go through them in order, Elizabeth. Lisa has asked, is it possible to have access to the PowerPoint? Would you like me to answer, Elizabeth? Give you a rest from talking? Lisa, this presentation, the webinar will be made available on drivinghealth.net afterwards. If you would actually prefer to actually have the slides themselves, please contact us using the info@drivinghealth.net email address, and we'd be happy to share a version of those slides with you. Kayla has asked a question, what was the sample size and location?
There's three different studies. So the online survey, there was 1,390 responses, and that was across the whole of Australia. The telephone survey was 332 people. So they were from within the online survey people who said, yep, I'm happy to be part of the next part of the study. And then the interviews, there was 19 drivers and 7 family members that I interviewed and they were spread across most of the states and territories of Australia as well.
Thanks, Elizabeth. Meryl has asked the question, and I might need to jump in on this one, Elizabeth.
Yep,
was suicide an issue in Victoria, or was this across Australia? Are the numbers broken down by state? So, Meryl, the data related to the suicides, it was actually across Australia. So we don't actually have that broken down by state. One of the reasons for that was just because breaking it down just meant the numbers got so small that it was difficult to be confident what the results will be telling us. So we don't have that those suicide rates broken down by state, unfortunately. Some more questions. Okay, Christy has asked the question, what topics will be covered in the training?
Yes, well, the training is looking at highlighting the factors that the drivers have identified influence their health, and also from the findings of our analysis as well. So it includes those things around what I mentioned, the personal health, the occupational health, the domains, the financial relationships, those types of things. And the aim of the online intervention is to highlight those factors that really impact on the driver's health and well-being from all of the data that we've got. And within that, there's a few questions and a couple of videos, and then a few more questions and a resource pack. So we're wanting to sort of raise awareness of line managers, supervisors, and allocators of the factors that they may have influence over, because people often say, it's the driver's issue because it's their health, so they have to be responsible for it. However, there are some things that the allocators, line managers, and supervisors can have influence over, and it's relating to this workplace culture as well. And so we have got these training videos, which are being filmed next week, actually. and a lot of the content comes directly from the interviews and from the narrative that was collected from the drivers. So it's hugely powerful and a great way of raising awareness for the allocators, line managers, and supervisors.
Thanks, Elizabeth. I've got two more questions here. One is from Greg. It's to what extent did the data show the extent that conflicts around compliance has on the mental health of truck drivers? He's given a number of examples. I'll just give you the first one because I'm mindful of the time. So, for example, a driver is asked to drive some excess hours because a customer needs an urgent delivery. So the driver is then confronted with a choice of either complying and keeping the customer happy or risking, for example, a crash.
And this was talked about quite a lot in the interviews that I did with people, and that whole lack of control over what they were able to do. There was like, I needed to comply here, otherwise I risk a fine of $1,500 or $2,500, or I have to do this because my boss is telling me to do this. And there was the huge sort of internal conflict around that. So I don't think we specifically captured that in the online survey or telephone survey, to my understanding, Ross, and you can correct me if that's not quite correct. However, we got some understanding of that internal conflict around that sort of depth of, it was like, do I do this or do I do that? I don't want to lose my job. And that was huge.
Another question. And I can answer this one for you, Elizabeth. Jason asked, was there any mental health concerns arising from COVID-19 testing or change in driver experience as a result of the pandemic? Most of our surveys were actually done prior to the pandemic. It's actually hard to think about a time prior to the pandemic. And so we can only imagine that some of the mental health pressures have increased as a result of the extra requirements on drivers of the pandemic. Sorry, I'm trying to make sure we cover all the... Jemima asked, were the responses broken into the age categories of the drivers? Basically, yes. And the full report of each of the stages of the driving health research, so the online survey, the interviews and the telephone survey, are all available on drivinghealth.net. If you'd like There are also summaries available, but if you'd like a snapshot, please contact us at info@drivinghealth.net. We'd be more than happy to correspond with you and share with you something that you might be able to find useful in your role. And Olivia has asked, are we going to share the recording of this webinar? And the answer is yes, it will be available within a week on drivinghealth.net. And our first webinar is already available, so you can catch up on that first webinar as well.
So make sure, I've just popped the link in there again to register for our intervention so that it comes down the bottom after all the questions and queries. Make sure you pop on there, pop your name and address in there, name and email address in there so that we can follow through and you can be part of the intervention part of it for, as I said, for supervisors, line managers, allocators, whatever they're called at that sort of level within your organisation. They're the people that we're wanting to target to complement the interventions that are going out there already towards drivers. Thank you so much for being here.
Thanks for joining us, everyone.